Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.
The strengths, weaknesses of what we can encash. And I think the policy which needs to be formed, that needs to help in creating this kind of environment and ecosystem for health tourism, including the what you called about, I think in terms of homestays, in terms of hosting the patients, attendees, which we need to kind of welcome along with that. Patients don't come alone. And that another factor which obviously will need to be taken care of. But thank you so much for taking time out and sharing with us your thoughts, sir. I will now request Dr. Edmond Fernandes to share his points, and then we'll quickly after that get into the discussion of what we have heard just now. What is the future scenario apart from health tourism, universalization of health services, which Dr. Srinath Reddy talked about it, and Meenakshi ma'am also. Dr. Edmond Fernandes, he brings to us, if I may say, a new perspective of whatever is happening around.
Good morning to one and all. Sat Sri Akal, Hari Om, Salam Alaikum. Honorable Governor in absentia, UT Administrator, colleagues from UNDP, Vikas and team, esteemed panelists, online and offline, invited guests. I bring greetings from CHD Group and the Edward and Cynthia Institute of Public Health from Mangalore in Karnataka. At the outset, let me congratulate you for participating and engaging in a nature and idea, perception, notion of Vision Chandigarh. I hope this serves as an echo for other states of what can be done, what can be thought through, and what needs to be done. Going by the order of the program, it's of course divided into three core pillars of social, economic, environmental, and then into 5 sub-themes. Before we get into all of that, I would request 10 minutes of your undivided attention to listen out to an incident. So this is the story about Asif, his wife, and 3 kids who've been living in a small-time urban settlement. Because of a pandemic like COVID-19, Asif was a mechanic who lost his job due to the closure of business. We all know about the impact of climate change, and due to this, the city where Asif was living in got severely flooded. Poor guy, his house was damaged, no social protection mechanism, and to top all of this, it served, while the flood waters were receding, this served as a perfect breeding ground for vectors. Yes, you're thinking it right. India is in the elimination phase for malaria, but there are other kinds of vectors, and Asif and his wife contracted dengue fever. To his bad luck, it wasn't just dengue fever, but it was dengue hemorrhagic fever, the worst form of full-blown dengue. His wife was fortunately doing a bit better. Asif's condition was deteriorating. What does she do now? The health systems, the overwhelmed health systems, told his wife, saying, go check for blood banks where you'll have platelets. So this poor lady ran from pillar to post, making inquiries in an urban congested environment, exploring platelets. What happens then? He and his wife both are patients. The 3 children, of whom another 2 are under 5, are going through food insecurity, on the verge of being malnourished, let alone undernourished, moderately malnourished, or severely malnourished. Why am I telling you this story? Because of the threat of food insecurity and malnutrition, their education has gone for a toss. So here you have urban planning, you have environment, climate, disaster risk reduction, you have health, well-being, nutrition, you have social protection, and you have education and skill development, all of which, just as a family, fits into 5 thematic areas. Does this have any resemblance for us? Yes, it does. As administrators, stakeholders, and policymakers in the process of not just tomorrow's idea, but a futuristic vision, what does this entail, or what can we learn? This family provides us with 2 questions. What can we do for them, and what can we learn from them? If we can answer these 2 questions as policymakers and participating stakeholders in this process, I think our converging year, my echoing of Asif's sentiments, there are 1,000 such families within Chandigarh, there are 1 million more within the country and across the South Asian or Asia Pacific region at large. This is not exclusive or inclusive to one region. The COVID-19 pandemic has shown us that we cannot live in exclusion, and we are in this together. So while we might prepare for a future-ready Chandigarh, what we need to also think through is how our cascading risk going to affect the region because of the strategic positioning of this city and the geopolitics at large. The answers we are seeking lies in the story presented. But however, for sake of brevity, I would like to walk through few pointers which an enlightened audience like this can pick up from. What do we need to do moving forward? Convergence of all line ministries and a public health in all policies approach. The policies being laid out for Women and Child Department, the policies being laid out for health, the policies being laid out by the Ministry of Finance, rural development, social protection, probably urban development. All of these need to have a public health in all policies. If you are going to say that, "Arey yaar, unko kaun puchega, hum kar lenge," and all, it's not going to work out. While our attempts might be appreciated, it's going to collectively fail. The point I'm trying to make is, what kind of a future are we building for our children and for our children's children? That's what we need to think through. Second, have a risk-informed planning approach wherein we map critical infrastructure gaps with the surge capacity to handle any kind of issue across sectoral line departments. Risk-informed planning is extremely critical for sustainable futures. Involvement of professional non-government organizations who could have certain initiatives tied to quality outcomes, demanding accountability, transparency of the highest order. Build a community-based model around social, economic, commercial, legal, and environmental determinants of health. Focus on the happiness index. We've heard a lot, we've done a lot, we've come this far. But let us inherently ask ourselves, are we truly happy? Has our own existence made us happy? And has our own life led to the happiness of others? It might not sound very technical, it might be philosophical, and to my critics I would stand guilty as charged. But deep down, as individuals and as children of this earth, happiness index is very, very critical to sustainable futures. A rapidly changing social fabric and a falsely created sense of security must actively be replaced by practices that prevent moral deterioration and deceptive illusion that we can achieve anything at all cost. COVID-19 has already demonstrated that we cannot even handle a virus, let alone anything else. Chandigarh would also have to channelize on reducing the burden of non-communicable diseases. And I am throwing an open challenge that let us aim for 10% NCDs by 2035. This is not an utopian ideology or an intention, but 10% NCDs by 2035 is achievable. As on date, Chandigarh has 63% of people who are obese, 41% of them hypertensive, 15% of them diabetic. What kind of a future are we building? Let's throw this as an open challenge. I am willing to work with UNDP and the administration in achieving this goal. This is not rocket science. This is absolutely achievable if we talk actions and not jargon. Another thing which I would like to point out is we have this Janta called MD community medicine people all around the country. As per the Medical Council of India or now the National Medical Commission, 865 MD community medicine people pass out from India every year. Where do these people go? This is a degree which is not commonly highlighted. We have heard of general medicine, we have heard of family medicine, we have not heard of community medicine. This is a perfect opportunity to create, wherein in fact Vikas was also telling me about how the dispensaries exist. But what do we do to strengthen these dispensaries? Take these MD community medicine people, offer a 9-month fellowship, train them effectively in NCDs, in mental health, in drug abuse, and push them into all these dispensaries. Because this field of MD community medicine guys can not just talk about preventive or curative healthcare, but can also do research wherein Madam was also saying about how epidemiologist was not involved in Delhi. But this is the same breed of people who can also do epidemiology, can get into research, can get into policy making. Why not utilize this talent that exists? Here is an opportunity at large. I ask of you, lastly, to believe in the intention of this visioning workshop. I ask of you to believe in the possibility of goodness. I ask of you to believe sincerely in the power of collaboration. If we do this together, I am confident that we might not need another visioning workshop, but our participation today will sow the seeds for tomorrow. With these few words, I would like to conclude. Thank you very much to UNDP and the Chandigarh administration for having invited me from Karnataka, and to all of you who have listened here. It's been a pleasure and honor to address you this morning. Thank you.
Thank you so much, Doctor. So we've had quite a few presentations. There's one video presentation which we can go later, but I thought this may be an opportune time for all of us to come in. We've heard and we do understand, I think in the Governing Council meeting also, which happened just a couple of weeks back, everybody from the Governing Council talked about these challenges which are there in the health system. We all are very clear about that. But in terms of strengths and weaknesses, we are doing it differently today. We are not doing Menti. We are trying to understand, we'll project it there. Let's talk about it. What are the strengths? Dr. K.K. Talwar very nicely captured a few of the things which we have. Please, let's just quickly rattle what comes to your mind and we'll put it all together. Yashpal Gargji, if you can start. What are the strengths of health system?
Very good hospitals, so far as medical care is concerned, may not be adequate, but professionally qualified doctors and medical care is very good here, number one. Number two, the access to the medical service, because it is very compact city, so you need not to travel much.
Thank you so much. We also have Director Health Services. Ma'am, would you like to share anything? What do you think are the strengths of Chandigarh health system?
Morning, everybody. I agree with the Health Secretary, sir, that Chandigarh is one of the few cities where everybody in the city gives preference to the government setup than the private setup because of our healthcare services available. Secondly, being a compact city, it is much more accessible. We also realize in bigger cities, a patient is lost in transition, in traffic jams, but the size of our city is to our benefit, where we can easily access us. I would like that these healthcare setups, where we are, we would like to strengthen them more. But the number of government setups available in Chandigarh are way better than any other city in the country, I'm sure. Thank you.
Any other strength areas anybody would like to add to? Sir, yeah. Yes.
I think for the second session, which is more the social aspect, but it was interesting to listen to you speaking very coherently. The last portion to try to articulate it. I think that Chandigarh's strength is there, no doubt, but we have.
Sir, let's talk of strength. For the moment, let's talk of coming to weaknesses.
We have a great strength in PGI, 32 sector and 60. And apart from that, we have few health centers like in our Punjab University, which caters to the university staff. But rest of that, we have a private system. So thereby, we find Professor Talwar would be agree with me. We have an overburdened PGI, which caters to the whole of Northwest India, even beyond that.
So overburdened PGI, you're saying weakness.
Yes,
It's a weakness.
the same with the sector 32, the same with sector 16. So in this context, we need to measure our strength by having an overall picture of this strength. Whether this strength is really in the right structural sense, or we just going to talk in terms of certain exclusivities, which may not make a strength. Strength is all inclusive, as he rightly said. Strength cannot be seen in pockets.
Sure. So what you're basically saying is that we are, as a city, we have a strong base, but that strength itself is becoming our weakness because so much is pressurized on that. Got your point, sir. Mr. Manmohan.
My name is Manmohan Serene. I'm president of the Blood Bank Society. And one of our strengths is that it is the voluntary blood donation movement which was started in Chandigarh way back in 1962 when Dr. Johnny came to the PGI and started the blood transfusion department. Today we have shown that voluntary blood donation has spread all over the country. And in moments like this, with the pandemic and with platelets being required, today, Chandigarh is supplying blood to the neighboring area. This is a real strength, and I don't think any city in the country has the movement so well organized as Chandigarh is. We should provide the leadership for the whole country.
Kapoor sir.
The biggest strength is the awareness about medical facilities. Awareness about the medical facilities and high-class professionalism. High-class professional and people are aware of it. And it is comparatively easily accessible. That is the biggest.
That's wonderful, sir. In fact, one of the points which Dr. Talwar and others, Health Secretary also talked, we have enough oxygen here, and supply of oxygen is where, given the COVID thing, we have enough oxygen generating plant. That is a very big strength. We have beds. We have never been short of beds during COVID, so we have enough beds for all the patients. That's a strength area. Yes, ma'am.
We have a very clearly defined hierarchy of infrastructure in terms of hospitals at city level, then at sub-city level, and at the sector level. There are a few which are wanting in it, but I think we can really capitalize on it when we talk about, at the source primarily.
Sure, sir. Anybody else would like to talk about strengths? Yes, Mr. Ghosh.
If you look at the national level trend and also the trend in most of the states, you do find that there's a shift from the public sector to the private sector, both in cases of hospitalization as well as the outdoor services. Chandigarh certainly shows absolutely different, and the percentage of dependence on the public sector facilities is very high. And I must tell you, the analysis shows that the affordability is an issue when it comes to the private sector. So certainly I do think that the high dependence on the public facilities, and it's not going down over time, over the past 15 years, certainly is a strength because it really makes the health facilities inclusive. Thank you.
So high percentage of dependence on public facilities, quite agreeable. The rest of the factor is that non-availability of the good enough private facilities. That also leads to the high dependence on public facilities. And there is a factor which is combining with that, because we discussed in the governing council, it came out. There are private hospitals, which Finance Secretary Sir pointed out. There are small little hospitals, 50-bed hospitals, because there is not enough space available, because the land itself is hugely expensive for anybody to kind of put up a very big hospital here. But that's why their Fortis and Max and Alchemist, etc., are outside of the Chandigarh periphery. They're in the Tri-City.
Because you know, it will be wrong to compare Chandigarh with Bihar, Madhya Pradesh, or UP. You compare Chandigarh with Delhi, Goa, Puducherry, you know, and you do find that the level of medical facilities is not that bad.
Yes.
But still the dependence on the public facilities is very high, which really makes the facilities inclusive, accessible to the poor. That's my feeling. And the percentage of poor in Chandigarh Union Territory is about 20%, which is less than national average, but it's not much less. So I think that's certainly a big strength for this.
Very right. And the other point which we also heard the other day in governing council, Mayor Sir will bear me out, was that you know, there are health facilities which have been allowed within the residential colonies. So now the residential people have a complaint that we need to shift them out because they are a source of disturbance and nuisance. If the ambulance is coming at such hour that they are not able to, you know, sleep or whatever. So that is something on the table. I'm talking again the weaknesses side, not as a strength side. But if I may say, as one of the weaknesses, that we need to build the even private sector health facilities little more in Chandigarh, so that the dependence on public health facilities may decrease. Secondly, which came out was that what Srinath Reddy sir also talked about, and Edmond discussed, that we need to build the dispensaries. The people should actually first call of action when emergency happens should be able to go to the dispensaries. So whether they are 24/7 equipped, whether they have specialists, whether they have that equipment which is there in the best of hospitals, needs to be seen. If that is done, then the pressure on PGI 32 and 16 will be less. So that's one area which is very clearly talked about.
The vision for Chandigarh 2030 and beyond, I think, is a very epic exercise which will set the tone not just for this city, but also have an effect on rest of the states of India. Across the thematic sectors, this presents a beautiful opportunity to implement a public health in all policies approach, work across line ministries, and implement a collective inclusion vision to build an egalitarian society with values of social cohesion and fraternity. Thank you.